What does being a facial financial advisor mean? Does that mean I'm going to help you with your taxes or I'm going to help you with your investments? No, I'm going to help you spend your money wisely with me. And so watch my video, Left versus Right Brain, because it'll help you understand a little bit about my philosophy, but I'm going to touch upon some of those concepts here. I'm going to tell you a story. The reason this was motivated is my last patient of the day I just saw. She has a little bit of a tighter budget, and she was asking where should she spend the money on her face. And so I said, look, the easiest thing for you is you need mesobotox. It's $1,200. I can work on this area and really make it look amazingly good. And she was really wanting fine lines in her lip managed. And I said, look, no one's going to be able to see that in terms of an improvement. And she's on a slightly tighter budget. So I said, look, let's figure out where the best use of money is, because the years of Botox they did up here already looked really good for her. She, of course, saw some fine lines that were not there. But I said, look, the texture and pore and tone here is really where I would go. And she says, well, how about my jowls? I said, well, you need a facelift for that. And I said, look, I know you're on a tighter budget. Let's not even worry about the facelift. I know that I can get the skin more balanced. That's where you should spend the money, $1,200. And she sat there very pensive thinking, should she spend? What should she do? I said, look, I don't want to be rude, but I want to ask you a simple question. Can you afford $1,200 today? She says, no. I said, done. So why are we thinking about this? So let's go back and do our Botox up here, because that's less expensive. I can spend the money there and you're still going to look great. It's not my number one goal. My number one goal is to balance the skin here and get you closer there, but it's a little bit beyond where you wanted to spend. So what I try to do with my patients is guide them. How do I guide them? I guide them with right brain thinking, which means what would make them look socially, professionally better? He says, well, why wouldn't a patient know that? Why wouldn't I walk in the room and, why wouldn't a patient coming in say, look, they should know their own face. They should be able to give themselves good advice. And the reason for that is that there's a distortion, all right? So women seeing things up close at magnification, at 8 to 10x magnification at 3 inches, always find the fine lines important. Now, sometimes it's important. I did a lady today where she was bothered by that, and I was bothered by that. I said, look, that's worth considering to do it. Now, you said, well, wait a second. Well, if I have disposable income, why can't I just come in and just do my fine lines? Isn't that easy? Well, sure, you can. Here's a few things. If someone's on a tighter budget and they want something to make them look better, if I do this, I feel as if I'm wasting their money, because if they don't have a major problem and I'm barely making inroads and improvements, sure, I can do it. I divide what I do into what I call green light, yellow light, and red light. Green light means please spend the money there because it's going to make a really good impact on you socially, professionally. Yellow light means I'm not going to hurt you, but it's probably a waste of money. I would rather not do it for you. I only like to do yellow lights, people that have very, very good disposable income. They have a lot of money to spend. I cover some greens, they look great. We hit some yellows because, okay, there's a little bit of improvement, but nominally so, and they don't mind wasting some money. But the person on a tighter budget and they go all yellow light, they may be upset at me because they feel like nothing got better. And the truth is, it didn't get better. Red light means, look, it's going to hurt you. You got big lips that look crazily fake and you want more of that. That's an absolute red light. You're not going to get that with me. You can find someone else without much taste and have them do it, because I'm not doing it for you. I'm sorry. And if you find that blunt and rude, I'm very blunt. I will tell you when something doesn't look right, whether you want to hear it or not. If that doesn't sound good to you, don't come to me. I like natural. And if you like to look natural, look at my video about your standard of natural is too low. It'll tell you about why I really believe some people wanting natural, they don't even know they don't look natural. And that's what I want to help you look better. So the other problem here with that yellow light of that fine line is that oftentimes the lines are so small that I don't get much improvement. And then the person's disappointed, especially if they're on a tighter budget and they go, my goodness, why did I just spend several $100s with you to fix this line? It didn't get better. Well, that's my fault for not telling you, look, I'm not going to get that much improvement on something I barely can see. And again, I treated lip lines today. And so I will help guide you and say, look, that's worth doing it. But this is an important understanding of what I do is I don't treat cancer or heart disease, right? So I'm not doing any emergencies here. There are no emergency lip fillers. There are no emergency fat graft. But what I want to do is help you spend the money wisely. That's why I call myself a facial financial advisor, because I want to help you allocate the funds well. But I always say it's a menu. If I give you, and you don't like filet mignon and you like fish, I'm not going to give you rotten fish, but I'm going to say, okay, you don't want the filet mignon? We'll go with fish. I'm not going to force you to do the filet mignon. You're maybe a vegan, a vegetarian. You get choose something else on the menu. There's no obligation to do what I recommend, but I will give you recommendations so that you know how to spend your money the most wisely with me. And that's the key. A lady today had some acne scarring and some intense pain of her jaw. And I really encouraged her. I said, look, I know you came in for acne scars. I would love to manage it, but I just see it in your face. I can see that you've got incredible jaw pain. I said, if I could give you a choice, if your budget is tighter, maybe consider just work on the jaw pain. And when I did it, she goes, oh my God, I feel so good. And I did both for her. But I will tell you, I'm just here to give you some guidance and some advice to how to spend money wisely with me, because what I'm doing is not dirt cheap. There's a cost to it. So I want to help you with that. There's no force or obligation, but it's helping you see what I see that you don't see, because I'm using more right brain thinking to help you integrate socially, professionally better.